Hello again. This is Cliff McWilliams with Corporatist Nation because that's what we've got. I'd like to talk to you a little bit about healthcare reform today and what that means. Back in 2008, when President Obama was running for election and indeed was elected, we had promises made that we were going to have healthcare reform. Well, I got news for you. Anybody who is a working person and tried to get Obamacare plans have found out that there's a lot lacking in that promise that was Obamacare so highly touted. And of course, we can't forget Max Baucus, who for passing that bill that was absolutely authored by the insurance industry, ended up with a $4 million consulting job when he retired after getting Obamacare through and signed. Insurance companies have done very well with Obamacare because it promised a lot but has delivered not so much. And what I'll show you here right now is a little sleight of hand that was part of the Obama campaign going way back at that time. We have health, standing together for health insurance reform. Health insurance reform. People want access to health care. That's what health systems management policy, health care policy at the graduate level talks about is access. And instead of, for the most part, improving access to health care for everyone, there were some people that did benefit from Obamacare and had some increased access and availability to health care. But when you look at people who actually work for a living, the promise falls very short. High cost, high deductibles, co-pays, very difficult restrictions on what your doctor is able to provide for you. So Obamacare fell quite a bit short. What is Medicare for All? It is merely changing how we finance health care on a tiered system of increasing participation in the Medicare program, which seniors can't wait to get into when they hit 65. And of course, some of that is bastardized by these Medicare Advantage plans, which takes the financing of your health care out of the hands of the government and puts the corporations back in charge. That's part of the deal, too, that's very raw. And I've seen people who literally were not receiving the care that they need, especially in cancer care, when they unwittingly turned over their Medicare coverage for a Medicare Advantage plan, what I call an Orwellian term. Now, when we're talking about socialized medicine, well, the VA is a perfect example of socialized medicine. People who have federal jobs and state jobs, those are a little less so, but certainly something of a similar sort. People love to have those jobs, a lot of people, because of the benefits that are associated with those jobs. Defined benefit pension plans and health care, and sometimes health care for life, which has gone away for the most part in the corporate sector. So what people need to understand is that you need to have access to health care no matter your situation. I think the culinary workers in Nevada figured that out, that if they lose their job, what does that negotiated contract do for them? It doesn't do much, because they lose the job, they lose the health care. With Medicare for All, people have access to their health care. One more point when we're talking about the dysfunctional nature of the corporate financing of health care. Everything has to be approved. And when you're a provider like myself, or a physician, or registered nurses that work for providers that have to make phone calls for often inexpensive medications, prescriptions that are written for patients in order for them to be able to go and pay for it or pick it up at the pharmacy, then all those costs are happening hundreds of thousands of times every day in this country, probably even more than that, in the millions probably, every day from individual offices across this country trying to ensure that their patients have access to their medications. And that's just one aspect of the whole thing. How do insurance companies make money? They make money by not covering people or charging usurious premiums for people that they prefer not to have to cover, huge deductibles and co-pays. This is how they make money. And sometimes they'll be denying those approvals for, say, radiation therapy for someone with a metastatic cancer that needs palliative radiation. I've seen patients wait a week for an approval for radiation therapy. This is not what America is supposed to be about. So, just something for you to think about. Remember, there's plenty of corporate socialism and not so much socialism for you. So people in South Carolina, we want you to think before you cast your vote. You think things are great for you, then maybe you want to vote for the centrist guy. If they aren't so great for you or your family members, then maybe you ought to think, maybe I need to vote for someone who's actually going to do what they promise that they're going to do. And in this election, that only person that will do that is Bernie Sanders. Remember, America is a corporatist nation. That's what we got. Thanks for watching.